Hi folks, this is Ali, and I'm sitting here on a plane traveling for a little vacation I'm taking, and I'm actually going right over the Bermuda Triangle right now. I'm heading out to Bermuda for a little vacation, and it kind of reminded me of all the conspiracy theories involved with the Bermuda Triangle, which further reminded me of some of the conspiracy theories that are involved with our own profession in endodontics. And of course, the number one conspiracy theory in endodontics is the focal infection theory. The fact that infection from the roots and the root canal can spread everywhere and is the source and the cause of all kinds of diseases and all kinds of afflictions in the human beings. This theory, of course, has been more in the news recently with the dissemination through the internet and this myth of root canals causing cancer through this little correlation causation quote that has been traveling around the internet, further perpetuating this myth of focal infection and all of these issues associated with calling out root canal therapy as a problem. So I will be doing a lot of tutorials in this area because I think it's an important thing, and these questions come up quite often, I'm sure, from patients, and it's our job as dental providers and endodontists to educate patients about the merits or their lack of the source of the information and alleviate their fears. Of course, when it comes to conspiracy theories associated with focal infection, and specifically this issue of root canals causing problems, everything dates back to a single person and a single source, and that's Weston Price. Weston Price, in his studies in 1925, showed some contamination around root canal treated teeth. That was really the main objection to endodontic therapy. Of course, later in the 1950s and so on, Weston Price's studies were discredited because of a lack of control, as well as the techniques where he extracted the teeth were shown to be not aseptic. So the teeth were being contaminated as they were being extracted from the bacteria from the sulcus, which is why he found a high concentration of bacteria on the root surfaces that had to do with contamination during the extraction. And this was the work of Easlick and a few other people in the 50s, and then became the foundation for discrediting the work of Weston Price. Of course, the myth has perpetuated and is now, in the age of the internet, is even more readily available through a simple click. So it's our job to be aware of these and educate our patients, of course. But just keep in mind that this issue of extraction being the only way to get rid of infection dates back also even before Weston Price to William Hunter. So William Hunter basically said that extracting teeth is the only way to address tooth infection, which led to a number of years where everybody basically lost their teeth. Extraction was the only thing that was being done. So lots of people lost teeth unnecessarily. And then later on, when it became clear that extraction is not necessary and there are ways that you can save teeth following pulpal infection, is when we began the era of saving our teeth. Of course, this is returning recently as a result of the internet, as well as, unfortunately, because implants have become commonplace. Many people have this idea that the implant would negate this problem with tooth infection. Of course, recent work is now showing that implants have also a 50% periimplantitis associated with them, which is basically the same thing as that focal infection issue. So this conspiracy theory is one that has been debunked clearly in our profession, but it persists as a result of the internet, as well as some of the special interests that are promoting extraction of teeth. The most important point of endodontic therapy and its success has to do with the quality of endodontic therapy, which is something that patients are not aware of. What we need to do is we need to let patients understand that endodontic therapy is not a commodity. It isn't a shirt that you can buy retail from a department store or at a discount store. It's the same exact shirt. Endodontic therapy is a skill and it's a service, and it's based on the skill set of the operator. And on our behalf, as the operators, it is incumbent upon us to get the maximum amount of training possible so that we can perform
these procedures at the highest quality possible. Because let's face it, hypnotic therapy is a medical procedure like any other medical procedure. And if it's done incorrectly, it will fail. Therefore, it is upon us to understand the foundations of success and maximize them so that we can provide the highest quality with the best outcome for our patients. Anyway, here I am on the plane on the Bermuda Triangle, getting ready to land and pondering these issues. I'll probably do a little video tutorial from the beach as well for you guys later on. In the meantime, I'm Ali Nissa, and I'll talk to you soon.